Coronavirus outbreaks in areas with low vaccination rates are driving such a large increase in demand for monoclonal antibodies that the country is starting to ration supplies, warning even some of the most desperate states, including Alabama, that they need to cut back on their orders of the life salve. To hopefully assure that monoclonal antibodies are available now and in the future for those patients most at risk, providers are reminded that not everyone qualifies for non-hospitalized patient treatment with monoclonal antibodies. While not a replacement for vaccines, monoclonal antibodies have. The antibodies, which are mass-produced in a lab, mimic the body's immune response to the coronavirus. They are infused into patients within 4 and ramp up the body's internal fight against the disease. 4 different monoclonal antibody treatments have been granted emergency use authorization by the Food and Drug Administration, FDA, and have proven largely effective at preventing hospitalization and death from COVID-19. The treatment developed by Regeneron, for example, reduced the risk of hospitalization or death by 70% in studies. COVID-19 hotspots have been increasingly turning to monoclonal antibody treatments as they battle massive surges in cases and hospitalizations overwhelming their healthcare systems. In Florida, where more than 90% of intensive care unit (ICU) beds are currently filled, more than 20 monoclonal antibody treatment sites have been opened across the state in recent weeks, and Governor DeSantis has vowed to make the treatment as accessible as possible. Another state told to reduce its orders, Alabama has been expanding its treatment sites as it grapples with over 180 more ICU patients than beds coupled with a staffing shortage. As part of its newly announced comprehensive plan for combating the Delta variant, the Biden administration on Thursday pledged to accelerate the distribution of monoclonal antibodies. It also introduced monoclonal antibody strike teams to deploy clinical personnel to help hospitals and health systems stand up the delivery of this key treatment option. The national supply of monoclonal antibodies could be impacted by the recent reapproval of the treatment co-developed by Eli Lilly.